baby is a patient in the newborn ICU, they are most commonly unable to orally feed due to their illness. When they are able to orally feed, this takes practice and is commonly a difficult skill to acquire. The NTrainer is a tool that we can use to help babies acquire that skill.
We designed the NTrainer to assess every patient's non-nutritive suck response and provide therapy to those patients who require additional entrainment to improve their non-nutritive suck response. This system has three major components. It has a patient management system, assessment mode, and a therapy mode. The patient management allows you to enter patients by name, track their progress with feeding and weight, and assessment indicators over time. The first thing that every patient has is an assessment, and the system measures the pressure applied to the pacifier down to fractions of a centimeter of H2O, extracting extremely detailed information about what that patient's doing, whether they're using their tongue, whether they're compressing with their mouth, how those compressions are grouped. All of this information goes into an overall understanding of how the patient's suck central pattern generator is functioning, how effective, how coordinated they are with non-nutritive sucking. Once an assessment's been performed and we know what their entrainment requirements are, entrainments can be prescribed up to 4 times a day for 2 or more weeks, just depending on the patient's need. Once the patient is on therapy, which requires multiple days, they're typically given additional assessments during the course of the therapy. This allows the patient's progress over time to be charted, which is also part of the patient management system. So you'll see graphical charts for sucks per minute, sucks per burst, burst per minute, suck pressure over time. These are all important parameters for a clinician to see and observe during the therapy. Based on these parameters, the clinician can make their own assessment on when that patient is ready to transition to oral feed.
There has not been a medical device that provides the stimulation to help the infant with this particular 3 motor skills that they need. There have been physical therapy exercises that can be done, but the therapists themselves have to do these consistently, and there's not enough of those therapists in a NICU to do this routinely with the infant. So this provides a system that's very reproducible, very consistent, and is very impactful for the infants.
All infants develop their non-nutritive suck response late in a full-term pregnancy. Preemies are denied that developmental period because they're born early. And in a NICU, there are so many distractions in their environment with noise, sound, trussing, feeding tubes on their face and oxygen tubes on their face, that this interferes with neural development in the suck central pattern generator. Because of this interference, preemies often don't develop a healthy non-nutritive suck response. The only way to regain that suck response is through oral stimulation of the patient. This stimulation needs to be as close to the natural non-nutritive suck response generated by the suck central pattern generator as possible, which is where the NTrainer fits in. It's designed through decades of research to most closely mimic that internal neurological suck central pattern generator.
The benefit to the professional are the reports that are provided from the NTrainer, the amount of information that the therapist can glean from the analysis of the suck pattern, the quiet times, the busy times within the infant's assessment will help guide the therapist in how long the therapy should be administered for this infant.
I've been practicing neonatology for many years and have seen the struggles that babies have with learning to orally feed. This is one of the most complicated things that a newborn does, coordinating feeding. I believe that this tool, the NTrainer, has a great potential for promoting those skills in babies and is one of the only tool that we have of that type.
The NTrainer is producing tremendous results. It's easy to use and yet has a dramatic impact on the infant.